Today, we have a pleasure of speaking with Dr. Priya Titus Singh, ma'am, an accomplished dentist, educator, entrepreneur, a classical Bharata Natyam dancer, and a mother hailing from Maharashtra, India. Ma'am's journey is a testament of her dedication and passion for dentistry, and she is here to share her experience and challenges with us today. Hello, ma'am. Very good morning. How are you doing today, ma'am?
Hi, I'm doing really good. Thank you so much. Thank you for having me.
Welcome very much to the show, ma'am. Coming up, ma'am, first of all, thank you for being here in the show today. Let us begin with your journey. Can you share us what inspired you to pursue career in dentistry, ma'am?
So my mother is a doctor, and she's a medical practitioner, a general physician. And the strongest memory, the earliest memory I have, as probably a 5 or a 6 year old, when my pediatrician asked me what do I want to be, I was like, I'm going to be a doctor like my mom. So I wanted to be a doctor. Around the time when we were, giving our CET and preparing for our entrance exams, around that time, Maharashtra government passed a rule which said that you have a compulsory rural internship to be done if you are doing MBBS, that is. And the course, which used to be 5.5 years, became 7.5 years. So, with that, it was a decision to be taken at that point. Do I want to continue with MBBS or do I want to take up dentistry? My CET scores were good enough for me to get a seat for MBBS as well. And in fact, when I did go to take my admissions, or rather, meet people before my admissions, they were like, oh, you will get MBBS very easily and it will not be an issue and this and that. But I kind of have grown up seeing my mother struggle as a general physician. I've seen her getting calls late in the night. I have seen emergency cases coming at our house, not at the clinic, but at our house. That doctor, please do something. And I've seen how hard it has been to for her to continue with all of that, and the toll it kind of takes on the family. I did not want that for myself. I wanted a slightly more relaxed life, I would say. Not exactly relaxed, but something where I don't have emergencies and I don't really have to struggle so much. I wanted some semblance of a work life balance. Now, my father is an engineer. He has been working for a multinational company for a good long time. Now, of course, he's retired. But that work life balance that I was searching for, the freedom to decide that, what, I want to just take a leave and go outside. I want to take a break and I want to travel a little bit. I saw my father doing all of that. So that was essentially what I also aspired, despite being in the medical or allied field. So by the time our counseling began for our admissions into government and private colleges, I chose to take dentistry. I chose to do BDS, and that was just the beginning. I mean, after that, I actually came to understand how much artistic work is required in dentistry, and in a way, good that I did not know about this before, because I don't consider myself to be an artistic person at all, apart from the performing arts part of it. So it was a good decision. Today, I'm really happy with the kind of quality of life I have. I can choose my working hours. I can decide how much work I want to do. I can take breaks when I want to. So in hindsight, it was a very good decision.
Well, I am not wrong if I tell you that you are a dentist by your own will, right?
Absolutely, absolutely.
And that's great to hear, ma'am. So, you have a very impressive career in dentistry, including running a successful private clinic at Kharghar, Navi Mumbai. Could you
Yes.
tell us about your journey in the field of dentistry from the time as an dental student to become an independent business owner?
Okay, so I was very interested in clinical dentistry from the time we were in college, in dental school. We start clinical postings somewhere around third year,
Yeah.
and I always wanted to see how a clinic runs. I have had the odd dental work in my own mouth as a child. So I have had extractions under some kind of conscious sedation when I was very young. I've had extractions later on under local anesthesia. Probably my lower incisors were a little crowded. So my mom's friend, who was a dentist, she had done my extractions. So I had an approximate idea of what is going on in a clinic. But of course, aesthetic and restorative dentistry was something totally new. So third year clinical posting started, and it kind of really made me very interested in knowing what exactly happens in a clinic. Because right now, what I'm seeing was in the hospital, in a dental hospital, what is happening. I went and I applied for a job as maybe an observer in the third year of dentistry. I was laughed out of my interview because they were like, "Oh my God, you're just a third year student. You still have exams to give. You can't think about working in a clinic right now. You're mad. Go back home and do your internship. That time you come back." So I was like, "Okay, I'll go back." Again, final year when final year started, I was like, "Okay, you know what? I want to go and join a clinic. I want to see what's going on inside a clinic." I again went back. Again, they told me, "You will not clear your exams if you try to come and work in a clinic. It's not going to happen. Please go back and come during your internship." Now, internship beginning, I again went back. I again asked, would it be possible for them to accommodate me? Now, around the same time, I also had my BA in Bharata Natyam going on. So, essentially, May I would be exam going for final boards of BDS, and November I would be exam going for Bharata Natyam BA. That is how it was. So the problem was I had classes in the evening because college was in the morning, and I would have class maybe 2 times a week. So I would not be able to give like the entire week to the clinic wherever I wanted to work in internship also because the Bachelor of Arts was still going on. So I did lose a couple of opportunities because of that. And I was told that maybe, when you finish your internship and you have the morning free, at that point you can probably join in the practice. And finally, that is what I did. After I finished my internship, I joined Home Dental Clinic in Compopedia, which is quite close to where I used to live. And from there, the clinical journey began. I got a chance to learn cutting edge aesthetic dentistry, composites. I learned implants. I learned lot of dental work over there under the mentorship of Dr. Komal Majumdar and Dr. Indranil Majumdar. They really guided me to be the best version of myself possible ever. They were very proactive in sending me for workshops so that whatever lacunae were there in clinical education as far as dental school was concerned, all those lacunae were slowly filled up. And I worked with them between 11 and 13 by the time I got married. And then it was difficult for me to travel up and down 2 times in a day from Kharghar. Kharghar is around 35 minutes away from the clinic at Kuperkherne. So then the decision was to, if it were possible, if it were okay with them, to also start my own practice in the evening and continue working with them for only the morning session. So they were gracious enough to allow me that, to let me have my own practice in the evening and continue working with them in the morning. So that way I continued working with them till 2019, where I had the clinic in the morning, which was their clinic. I had my own practice in the evening. In between of this, I also completed my bachelor's in Bharatanatyam. So that was around 2017. I finished my bachelor in fine arts with a distinction. And with this, by the time it was 19, then I was ready to move on. There was a lot of time management issues that I was facing by then because I also started teaching aesthetic and restorative dentistry by 2017. So I would be working weekends, I would be traveling overnight to places in Maharashtra, far away. I've done south of India, I've done north of India. So it was getting very hectic for me to, even get that break. I was almost on the brink of a burnout when I decided that, what, I need to let go of something. And so that's how I then shifted completely to full time my practice in 2019. And then after that, COVID hit. So we all took a break for about 2 years. I also had a baby around that time. So my time got divided between the baby and the clinic. 2021, I resumed my practice. And now 2024 January, I'll finally be completing 10 years of my clinic over here at Kharghar, Navi Mumbai. That
Wow.
has been the journey so far.
Wow, ma'am, it's really good to hear that. And as a student, also, you were very curious.
Oh, extremely. I was a
Uh,
total enthu cutlet.
Well, ma'am, we understand that you have a keen interest in aesthetic dentistry, implant dentistry, and restorative dentistry, and
Yes,
even dental photography. Can you share some
yes.
insights into what drives your passion for these particular areas of dentistry, ma'am?
I think one thing is that you have to like what you do. So I really like aesthetics. So that's what drives me. That's one of the very key ingredients of doing well, success later on also. And the other thing is a little bit of giving back to the society. I have always aspired to be somebody who can guide other people who are in need of guidance. Primarily because I recognize my privilege. I understand that if I had not gotten that job with Dr. Majumdar so many years ago, I probably would not be where I am today. And there is a lack of genuine mentors in dentistry. People end up going to wrong places, end up learning unethical work, unethical dentistry, even more so with the corporatization of practices which we are seeing around us, target based, and this much income has to come, convert every patient who's even come for a scaling for 3 lakhs worth of treatment, that kind of work. Uh, I recognize that there is this problem with our society right now. Not only dentistry, but a problem with the world right now. And I would like to make small changes to that, if whatever is possible within my limits, of course. So, dental photography, like you asked, documenting your work and showing stepwise work is one step towards that, where we are trying to essentially show people what is the right way of doing things, the correct protocols of following. How do you proceed with a particular restoration, for example, or implants, for example. So that is one part of it where we are sharing this knowledge with our other dentists, our colleague. Also, sharing all this on social media creates this understanding among people who are seeing us, who are not dentists, potential patients, so to say, or lay people, to understand that there are good dental practitioners and there are bad dental practitioners. So, creating that knowledge among the public, among the general public, to understand what is good dentistry and why is it expensive, why do they have to pay for it, why does it take a long time? Why is it slow dentistry and not quick and super fast dentistry? This I think is very important. And this is my way of giving back to the society. I would like to spread enough awareness among my peers, among my colleagues, among people whom I studied in school with, for example, who are not dentists, that whatever work you get done in your mouth has to last a good long time. It has to be ethical. It has to be scientific. It cannot be depending on the whims and fancies of any random person. It has to be scientific. And for good quality work, you have to pay, because people have this wrong idea that dentists make a lot of money. They don't realize the kind of overheads we have. So creating this awareness is something which is very important. And then when you show your work to people and they realize, okay, the quality of work is really good, that is when they start valuing your world as a dentist. From your past podcast, Doctor, I saw that most of the dentists who were there, they were not people who chose dentistry as a profession, correct?
Right, right, right.
Yeah, they were mostly people who wanted MBBS but didn't get it, so that's why they took up DDS.
Now also the
So
situation is same, ma'am. If
it's
I'm,
very similar, very
yeah.
similar, yes. Because general population does not know about dentistry. That's one. Second thing is the fear of the dentist is very huge. Like even today we are having movies made on Netflix which are serial killers who are dentists, and what special torture ways they find out to torture their patients on the chair, right?
Yeah.
And little children, when they're eating chocolate, their parents tell them that, your dentist will give you an injection. So the little children are scared, and those children eventually become adults and they need dental work. And they're so scared of the dentist. So, general population, when you ask a youngster, do you want to be a dentist? They'll be like, no, because that is the image they have of a dentist. So, that is what we need to change. That's what we need to work on changing. And that's when you will end up getting people who are choosing dentistry as their field out of a sense of that's what I want to do, and that's how the profession will improve. That's how it will keep getting better.
Great,
So
ma'am. So it was very great hearing this, that people are working on educating people, promoting dentistry basically, which is much
yes,
needed nowadays.
absolutely, absolutely.
Ma'am, you are an accredited member of Indian Academy of Aesthetics and Cosmetic Dentistry and have published
Yes,
article on anterior direct and indirect restoration.
yeah.
How has your your involvement in professional organization contributed to the field in shaping your career, basically?
So I became a member of the Indian Academy of Aesthetic and Cosmetic Dentistry in 2013, I believe. That was right before I opened my clinic. And I attended the conference. I went to see what other aesthetic dentists are doing. Of course, the big names in dentistry, who are 25, 30 years into practice, and also people who are obviously senior to me. So it was quite eye-opening because when we are sitting just in our clinic and we assume things about the kind of practice we want to do, we don't make a very informed decision because we don't know what is going on outside. Going to these conferences, becoming a part of these kind of peer bodies, it really helps you to know what kind of dentistry is happening outside. And apart from this, I'm also a part of the Indian Society of Oral Implantology. I am also a part of the Academy of Cosmetic Dentistry India. And attending their conferences also gives me a very good idea of what dentistry is doing, not only in India, but also abroad, also overseas. One thing is it again makes us aspirational to, be able to deliver the same quality of work as to what's going on in Europe or in America or in Australia. It's the same. And then we work towards it, right? We work towards getting the same equipment over here. We work towards getting the same dental materials over here. We work towards all of that. We also go abroad and take training and come back and, practice it to our patients so that we can give them world class dentistry. So that is one aspect of it. Another thing that being with IACD, for example, helped me was I started talking about aesthetic dentistry quite a lot. I started presenting papers. I became a speaker essentially for aesthetic and restorative dentistry because of the IACD. I got my first lecture after I presented a paper at IACD. So that is another thing, exposure. Exposure is what these kind of conferences and academies definitely give you.
Well, ma'am, I had something to ask in person.
Yeah, yeah.
Nowadays, people think aesthetic dentistry is all about fillers, Botox, this, that. So, what you have to say about this? Is it really the scenario that aesthetic dentistry is all about fillers, Botox, and all those sort of thing, chemical peeling and all that, or it is the other side of creating beautiful smiles with the help of implants, veneers?
So aesthetics as such can be divided into dental and facial. Dental aesthetics is what you're describing with implants, with veneers, with composites, with bleaching, with all of that. Facial aesthetics goes on for your hair transplant, dermabrasion, Botox, fillers, all of that. So there are two separate branches, if you ask me, of medicine, but one is purely dental and the other is slightly towards leaning towards the facial aesthetics part of it. And the specialities are different. Of course, head neck face surgeons, oral maxillofacial surgeons who have trained in dentistry and they have an extensive knowledge of how the head neck face work, every plane of the head neck and the face, they would be able to practice facial aesthetics as well because they have the knowledge base, right?
Yeah.
For a dentist to practice that, probably years and years of training would be required. But for the dentist to work inside the mouth and deliver beautiful smiles with whatever teeth are missing, preserving what teeth are already there, replacing lost tooth structure, replacing lost gum structure, gingival structure, that is totally in the field of dentistry.
Yeah, ma'am. So it was very enlightening hearing this. So now coming apart from dentistry, you have told us that you are also a Bharatanatyam dancer. Apart from dentistry, you are a classical Bharatanatyam dancer with a distinction in Bachelor's of Fine Arts. Could you tell us about how you managed to balance your dental career with your passion for dance, ma'am?
I have actually been a dancer longer than I have been a dentist. I started dancing at the age of 6, and I went through formal schooling of Bharatanatyam when I was very young. Subsequently, of course, we moved places, and then access to a teacher was very difficult. And then, of course, the pressure of academics came in where 9th, 10th standard was okay, board year, and you need to concentrate on your studies and all of that. So essentially, I took a break around 10th standard, your SSC exams. Around that time, I took a break, and that went on for about 5 years. I was not able to get back to dance no matter how hard I tried. So there was 11, 12, there were classes, there was board exams, HSC after that, and then dental school. By the time dental school started, college is a very huge shift from school. When you jump to college and then a lot of self-study is there, and it's not really like people are spoon feeding you everything. You really need to sit with your books. So that shift was a little, what do you say, a little hard for me. So I was very underconfident that I would be able to balance dance also at that time. So the first 2 years, I didn't even try. I didn't even try to get back to dance. Finally, by the time second year got over, third year began, I was like, okay, you know what? Now I feel that I can get back to my dancing. So I went back to school. Because it was after 5 years of break, I had to restart and get my body into place, get physically fitter so that I could dance. And while dental school was going on, I was also giving exams for Bharatanatyam. And after that, I had my performances and all, and final performances, final exams, all that after I graduated, much after I graduated. So it was always a fine line because morning was I had a job, I had a clinic going on there. Evening I had my own practice where I was working, and somewhere in the afternoon I had to find time and go to my teacher and rehearse, sit with my books and study. And of course, the days I had exams, I had to take leave from everywhere. So for my final BA, I remember I had kept my clinic closed for almost a month. I would just rehearse with my teacher, and evenings I used to be exhausted. I didn't have the energy for doing clinical work unless there was like an emergency or something. And it was the same when I did my Arangetram also. And Arangetram is typically your maiden performance, which you perform in on the stage in front of an audience as your first offering to God when you perform. So you have to be, it's like a professional performance where you have the proper costume, the makeup, you have musicians who have come to support you through your performance. You have an audience of, we had about 600 people attending our Arangetram. I did it with three other girls.
Wow.
So it was a very big performance and it was a huge milestone for me as a dancer. This happened in 2015, I believe. And so again, around that time also, the rehearsals used to go 3-4 hours in the afternoon. And after that, I had no energy left to go back and work in the clinic. So evenings, I used to keep my clinic shut. I must have done that for about 1 or 2 months.
So,
It was hard.
so do you still perform, ma'am?
Yes, I do. I do.
Wow, kudos for
Yeah.
you,
So I
ma'am.
again, thank you so much. I again took a break during the baby, during COVID. Of course, everybody was on a break, but my break got extended because I also had the baby and I had a cesarean section. So it was a proper abdominal surgery. So recovering from that was about 2 months. And then getting to a state where I could dance again was another 6-7 months. So again, there was a long break there. I restarted Bharatanatyam in 2021 July and it's there. It's still going on. Right now, on a little bit of a sabbatical again because my teacher has moved to Goa, and I'm waiting for her to settle down. Once she settles, we'll start online classes again.
Wow, ma'am. Well, many of must have not seen this aspect of yours, and one more another big aspect of yours is motherhood.
Yes.
One aspect of your life that adds a unique dimension is your role as a mother. Could you share some insight? How do you navigate the challenges of being a full time mom while maintaining the dental practice and pursuing your artistic interest, ma'am?
You should also ask this question to the guys. Okay, how do you balance being a father and also take care of dentistry? Only then will I answer this question. Promise?
Yes, ma'am. Surely, I'll.
You really should. Okay, so I think motherhood makes you a superwoman. It essentially shifts your priorities completely in the world. It completely makes you aware of who you are from within. Whether you paid attention to that before or not, some people are very self-aware right in the beginning. But for me, that self-awareness came only after I became a mom. Balancing motherhood essentially means getting ready to give that little dependent soul whom you've brought into this world a lot of time and attention because that's what they need from you in the first few years. That initial 5-10 years is probably when they will need you. After that, they won't. After that, they will have lives of their own. They will have classes, they will have school, they will have friends, they will have teachers whom they absolutely adore. So the requirement of the parent probably reduces once they are 10. So this 10 years is going to be baby centric for me right now. Of course, he's only 3 years old right now, so I still have a long way to go. But it is a conscious decision that since I have decided to have a baby and I have to give that time to my baby, that yes, my clinical work will be a little lesser than what I used to do before the baby. For example, we as Indians, I think, typically kind of glorify overworking. We kind of glorify working ourselves to the bone, glorify working ourselves till the point we reach a breaking point. I mean, it's a very proud thing to say that I work till 3 in the morning. I'm talking about other people. Dentist का तो फिर भी clinic में 12-1 बजे के बाद नहीं होता है, but still people I didn't sleep all night and I'm here in the morning and, I'm working again at 6 in the morning. I've started working again. We glorify overwork quite a lot. Motherhood kind of puts that into perspective. You realize that while taking care of that baby, you are so overworked already that any other work becomes superfluous. It's like, मुझे ये करने की जरूरत नहीं है, मुझे ये करने की जरूरत नहीं है. I have to learn to prioritize because other things are not important. This is important. So for me, the decision was to reduce my working hours, to not work as crazily I used to work before. Take lesser lectures. Yeah, take lesser lectures. I used to work 7 days a week at one point. So I decided, okay, I don't want to do that. I reduced that to 4 days a week now. I used to work 10 a.m. to 2 p.m. and maybe 6 p.m. to 10 p.m. earlier with a break in the between 4 hours, which I used to get. But now I have to give that time to my baby because he needs me the most in the evening. So I work 10 a.m. to 4 p.m. today, and I work 4 days a week. So I have reduced my work hours so that I can spend more time with my child, and that's something which I think all parents need to do. They have to be kinder to themselves. They have to take care of the children at the same time. Also, make sure that they themselves don't get burnt out because caring for a child is an all-time job. It's a full-time job. So they have to learn to prioritize. They have to learn to manage their time. It is possible. It is definitely possible with a good support system at home. Like I used to cook at home once upon a time. I like cooking. I enjoy cooking, and I think the amount I cook during the lockdown is something I have never done in my life. So I think all of us became amateur bakers and chefs around that time, right?
Yeah, yeah.
So I did a lot of cooking, and I thought, maybe after the baby also I'll find time to cook, but then that's not happening. My kid loves to play with me. The moment I'm in the kitchen, he's like, "Mama, come outside, let's go play." So no chance of trying to work in the kitchen. It's very, very, very hard because his play is important. That's how he learns. So I kept a maid for cooking. I kept a maid for cleaning. I have a dental assistant in my clinic. I have somebody who comes to clean in the clinic. With all this support system, I also have the school. Before that, it was daycare, which took care of him for about 3-4 hours in the day. And my parents are nearby. My husband also has reduced his work a little bit. So between my mom and me, we take care of him she works half the week, I work half the week. And husband is there for one day in the week to look after the baby. So when they say it takes a village, it actually takes a village to raise a child. You actually need support from everywhere. Only then a woman is able to go out of the house and work. Like on a routine basis, I meet female dentists who come for my workshops, who come to learn from me. And they're like, how are you doing it while your child is so small? Because we could not even step out of our houses and go to clinic when we had a small child. I was like, yes, it's very hard. It's extremely hard, and society puts this pressure on us that we need to do everything ourselves. But it doesn't actually have to be that way. You can take some help, and there is no shame in admitting that you need help. You need help, you need it. It's okay. If I need to go to work, there has to be somebody looking after the baby at home, and then that somebody has to be paid by me, employed by me, or if somebody in my family is doing it out of the goodness of their heart, I'm lucky. I'm very lucky that my mother takes care of my child when I'm not able to, because then I can go and concentrate at work. I can be 100% there at work. So it takes a village. It really takes a village.
So actually, this side of your motherhood is great to listen, that you are a good, curious dentist as well as an well caring mother even. So how did I reach you? While I was hunting for some profiles whom to interview, I came across a word or on Facebook page called Compopedia. So then
Okay.
I started doing a research. What is this Compopedia? And somehow I landed to you now. So I'm
Okay.
interested, and even the listeners are interested that what is Compopedia basically. We would like to know more about this Compopedia.
Compopedia is basically an anterior and posterior composite workshop, which I conduct over 2 days. And I basically teach dentists how to do composites the right way from start to finish. So my training with composites happened only after I graduated dental school. In dental school, we didn't have composites as a part of our syllabus. And that was a very big void because when I came out, I realized private practice, nobody is doing silver amalgam. So it was very crucial for me to learn how to do composites because patients needed to be treated with composites. So that's where Compopedia came from, where I decided that when I teach, I will put a lot of emphasis on how to do composites in aesthetic and restorative dentistry. Apart from composites, we also teach laminate veneers. We also have rubber dam isolation, dental photography, sonography. We have minimally invasive dental procedures like bleaching, microabrasion, resin infiltration, posterior bonded restorations. We teach all this as a part of our curriculum in aesthetic and restorative dentistry. So Compopedia is one part of that full course.
Wow. The name is
Yeah.
actually very interesting, ma'am.
Thank you.
Uh, Lastly, as someone with a successful career in dentistry and diverse interests, what advice would you give to the budding dentist who aspire to achieve a similar level of success and fulfillment in their career?
I would say the initial first 4 or 5 years of your career, you would have to find out what you actually like to do in dentistry. Because a lot of people that, my clinic or I myself should be able to do everything in dentistry. So whatever is required in general practice, whether it is scaling, whether it is fillings, whether it is root canals, whether it is crowns, whether it is denture, whether it's implants, they try to learn everything possible. The problem with that approach is that, of course, you would learn everything, but you will never become an expert at anything. You would end up investing a lot of money in all the armamentarium and the materials that are required and all of that, but there will be no expertise achieved. So you would maybe manage to do some work with some mediocre level equipment or mediocre level materials because otherwise it becomes too costly. So don't have that approach. Initial first 5 years, find out what you like to do in dentistry. And once you find that, whether it is surgery, whether it is restorative, whether it is root canals, once you find that, start becoming an expert in that. So join those academies or those peer groups, the peer bodies, like how I am a part of IACD and ACDI. Find that body for yourself and go and get into the fellowship program or the accreditation program that they have, or the attend their annual conferences and keep getting better at what you're doing. Even in one particular procedure, there might be a lot of other procedures which are possible. Like if you look at endodontics, there is so much to do in endodontics. In that itself, there will be a different set of equipment required to do the best quality work that you want, whether it is magnification, whether it is a microscope, whether it is learning how to use an apex locator, learning how to do activation, use of ultrasonics, basically. So there is so much that you can actually learn. You don't really have to do mediocre level work which you studied maybe during college, which was 20 years old syllabus which has never been revamped, and it's not clinically relevant today anymore because technology has really moved on. So become an expert in what you like to do. Then you invest whatever extra funds you have annually for that equipment, whatever you require, and keep growing in that. Whenever you're working in your practice, your focus should be that one subject which you really like to do. Beyond that, of course, it's not like you don't know the other clinical work, but also have a group of people whom you can fall back on for those kind of cases, which you don't want to do. Like if oral surgery is not my forte, I have an oral surgeon who can come and do it. It is their forte. They like to do it, right?
Yeah.
So call them, let them do it. Orthodontics is something which I don't know at all. I have a very good orthodontist who takes care of all my patients who require ortho. So it's not like that work is not happening in my clinic. It is happening, but I don't have to do it. Let them do it. Let the specialists do it. And I become a specialist in the field that I like to work in. So find your niche. That's extremely important. Keep an annual budget of clinical skill improvement where you go and learn something from somebody who's an expert in that field. Keep an annual budget for clinic improvement where you're actually investing in your clinic, improving whatever equipment you already have, upgrading or adding to that, adding to whatever armamentarium and dental materials you already have. And this is how you grow. This is how you essentially keep getting better at the work that you're doing. This is my take home point from all of it.
Well, thank you, ma'am. Thank you for sharing your remarkable journey and insights with us today. Your dedication to dentistry, dance, and motherhood is truly inspiring, and we wish you to continue success in all your endeavors, ma'am.
Thank you so much.
Thank you, ma'am.
Thank you for having me. Thank you for having me on this podcast. It's the first I've ever done. I've never done a podcast before this,
No.
and it is interesting of how media is changing and how we consume media is changing. Personally, I'm not much of a fan of this audio thing. I mean, putting the earphones in your ear and listening to it. It's always something blaring in the background. I never really pay attention to it. But now that I have done one, I'm going to start looking into how I can use this medium even more in the future. So thank you for exposing me to that, doctor.
Oh,
It is
welcome,
really,
ma'am.
really nice. Yes.
Thank you, ma'am. Thank you for your precious time once again. So, I'm your host, Dr. Ganendra. As we wrap up this insightful conversation, I encourage all the listeners to connect with us on social media, and keep your ear out for upcoming episodes of the MolarBear. Stay engaged, remain inquisitive, and continue to share your wonderful smile with the world. Thank you for joining us today. Bye bye, and have a great day ahead.